This semester, the community-based research scholars, we partnered with United Planning Organization to assist with conducting the community needs assessment, and we decided that we would get our boots on the ground and talk to some people in the District of Columbia. We got 700 surveys. So they got into small groups based on different interests, and then they're going to be presenting to you the findings related to those interests. So that's crime and safety, health and wellness, housing and homelessness, education, and issues affecting immigrant communities.
So through our surveying, we formulated the question, how do race, gender, and ward location influence public opinion on policing?
And we were able to find that there was a statistically significant difference between males and females in their opinions of the police.
We got a chance to look at some of the qualitative data given by the open-ended questions at the end of the CNA, and we found that the majority of free response questions that they answered about the police said that they advocated for more police and better policing in the community. So a lot of people said that they wanted more police presence and more consistent police presence, so the same officers working in the same neighborhoods, so they get to develop connections with the community members.
So this kind of highlights the disparity in the quality of education between the wards and how that affects whether or not people would like to send their children to public schools.
We recommend expanding programming by including more students in Head Start, because in the CNA, 33% of people who were talking about being unable to receive help for services, they were talking about not knowing where to get help.
The first issue that we looked at was the access to healthcare and access to Medicaid and Medicare, and where the respondents to the survey got their healthcare from. And
our first recommendation is the introduction of health education. At the focus group that we had held at the PD Green Center, there was an overwhelming amount of respondents that had said that they would have liked to see in schooling and education of the introduction of health education. It is
This data comes from the focus groups that we conducted, where the majority of respondents rent their homes but don't receive rental assistance, which is confirming what we saw on the last slide from the quantitative data. And furthermore, many of the people that we surveyed wanted a greater voice in their communities.
I believe that we need to work on this long-term affordable housing in order to alleviate the current hardships that families in DC face and to start these families on a path of economic stability.
These individuals want to be a part of these communities, they want to contribute, and this could also be because of a language barrier, that they're not able to voice their opinions in community settings easily.
A lot of the existing city services, and to be 100% honest, this includes UPO because you guys have been around for so long, they weren't set up to support the growing immigrant population. As you saw in one of our first slides, it has doubled, tripled in recent years. And so I think that in general, we can update our infrastructure to provide more for those immigrant populations.
I want to say thank you to everyone who has contributed to this project, because you have no idea what a big help it is to us. It's been a very pleasant experience working with American University on all fronts. We continue to get support from American in so many different areas. So I want you all, especially those of you all who are going to make a career of this, to understand how powerful the work that you have done and will continue to do can have when used correctly by an organization that really wants to make a difference. So I'd like to thank you.